Sean.
Hi.
I'm Cindy. I'm going to be your nurse practitioner
Nice to meet
today.
you.
Sean has agreed to be the volunteer for my assessment of the eyes, ears, nose, and mouth today. And Sean's over the age of 18.
I am.
Okay, so we're going to start off today. We're going to check your visual acuity, and we're going to do that using the Snellen chart. And we have it over here on the wall. And if you could just please read the very last line there for me.
LTPQF.
Perfect. Sean read that at 20/20, so that means you have perfect vision compared to the rest of the population. And so the next thing that we're going to do is we're going to check your visual field doing something called a confrontation test. So if I could just have you stand over here. And what I'm going to do is I'm going to have you cover your right eye, and I'm going to cover the same eye as you, and I'm going to bring my fingers up, and when you see my fingers in your visual field, would you just say that you can see them?
Now. Now. Now.
Good. Now we're going to do the same thing to the other eye. I'm just watching your muscles in your eye.
Now.
Perfect. Okay, now we're going to do one more test to test the muscles in your eye. And what we're going to do is we're going to do something that will check the 6 cardinal fields of your gaze. That's checking your ocular muscles as well. And what I want you to do is I'm just going to hold my finger here, and I want you to follow the movement of my finger without moving your head. Just use your eyes to follow the movement. Perfect. Okay, you just want to have a seat. And while I'm checking all of the muscles in your eye, I'm going to go ahead and shine a light in your eye and look at the pupils to check the muscles and the movement of the muscles of the pupils to make sure that they're working properly too. So I'm just going to shine this light in your eye. I just want you to look straight ahead at me. It's going to be bright. Good. And what I'm checking for is called perla, and what that stands for is the pupils are equal and reactive to light and accommodation, and you did that perfectly well. So I'm going to now just look at your eyebrows and make sure they're symmetrical and kind of palpate around here. Can you close your eyes just a minute? And I'm going to palpate your eyelids for any edema. Is that tender anywhere in there? I don't feel any nodules or anything like that. Okay, just look at me, and I'm going to pull the eyelid down and just look inside a little bit. Okay, and look down, and I'm going to come here. Perfect. And what I'm checking for is just to see if there's any drainage in your eyes, and to see if you have any redness in your eyes, and your sclera is white. It looks good and clear. And your cornea is clear as well, so that means there's no cataracts because there's no whiteness to the cornea. Your iris is blue. So your eyes look moist, and your lacrimal glands seem to be working, and because your eyes are moist, and the mucous membrane in the eyes is pink and moist. And do you have any pain in your eyes? Okay, good. Now I am going to use the ophthalmoscope and look in your eyes. I'm just going to be looking for the lens clarity in your eye and the red reflex to see that your eye is normal. Good. Good. And what I was checking for there was just to look at your lens to make sure it's clear. And you had the red reflex, and that's good. Your retina was a brownish, orangish color, and that's normal for you as well. And your macula looks good. There's no blood vessels in it. I can see the blood vessels in your retina, and that's normal. And the edges of your disc were sharp and well defined, so that's a normal eye. We also checked the chamber to see if it's too deep or too shallow, and yours was normal, just normal like a normal eye would be. Mm-hmm. That's all of the eye exam. So now we're going to go on. I'm going to check your hearing. So first thing I'm going to do is I'm just going to look at your ears, the external ears, and just kind of feel and palpate. Your ears look symmetrical, and I don't feel any nodules or like any lymph nodes are swollen or anything there. Do you have any pain in your ear? And part of what I've been doing while I've been checking you is testing your hearing as you answer my questions, and you haven't had me repeat anything, so that shows me that you are able to hear pretty good with just in a normal range here. But we are going to do a couple more hearing tests, and I'm going to use, we're going to do a couple different tests, and one is called the Weber test, and we're going to do that with this tuning fork. And what I'm going to do is I'm going to make it vibrate and place it on the top of your head, and I want you to tell me if you hear it in one ear or in both ears, okay?
Both.
Good. Now we're going to do the same thing again, but I'm going to place it back here behind your ear on the mastoid bone. And I want you to tell me when you stop hearing the sound.
Now.
And tell me when you stop hearing it.
Now.
Good. And do the same thing again.
Now.
And again.
Now.
Perfect. And what that does is it checks the conductivity of your hearing through the bone and also through the air, and the conductivity through the air, which goes through the ear canal, should be twice as long as what it is in the bone conduction, and yours was, so that was normal. So now I'm going to look inside your ear with a light just to look at your eardrum. So I'm going to pull your ear up and back just a little. And I'm looking in there to see if you have any earwax in there, any cerullum, any redness, or any lesions, or how your eardrum looks. And your eardrum looks good. Your eardrum is kind of a grayish color, and it's not bulging, and it doesn't look red or anything, so that means there's no infection in there, no fluid behind your ear. There's no perforations. I don't see anything in there that looks like you have had, any ear infections that have ruptured your eardrum or anything like that. And so I'm going to do one more thing to check your hearing. It's called a whisper test, and I just need you to sit there and look straight forward. And I'm going to whisper a word behind you, and I want you to tell me what you hear.
Puppy dog.
Good.
Kitty cat.
Perfect, and you passed that well. So next I want to just check your nose, check your sinuses a little bit. I'm going to palpate right here on your frontal sinuses, and they don't feel swollen or anything. Is that tender to touch? And these are your maxillary sinuses. Do they feel sore, tender? There's no swelling or anything there. Okay, and I'm just going to look in your nose and check to see that it's not got any drainage or. Good, I can see that your septum looks like it's normal, it's straight, and you don't have any drainage in your nose, and the inside of your nose is nice and pink and dry. It's not too dry, but it's not too moist, and your bone structure here seems to come down straight like it's supposed to. And so now I'm going to move on. I have one more test for you to do with the nose. If you could just put one finger and then kind of exhale out. Good. Do the same thing on the other side. Good. Now I'm going to check your mouth and just look to make sure you don't have any sores or lesions or anything in there. And I'm just going to kind of look at your lips here. Make sure they're not too dry. No cracks or any kind of lesions or anything on your lips. Sorry. And then okay, so if I could just get you to open up, and I'm going to look inside your mouth. I'm going to check your tongue and check your gums to make sure they're not red, don't show any signs of gingiva. Checking to make sure you don't have any tumors, make sure you don't have any kind of, looks like anything that looks suspicious for cancer. And if you could just stick your tongue out for me and say, ah. Good, you got a good gag reflex. And just stick your tongue out. And your tonsils look good. They're not swollen or red or anything, and your palate looks like it's all closed up and no redness or sores in your mouth. And I have one more test that I need to check, and that's gonna check your 12th cranial nerve. And what I want you to do is just to stick your tongue out, and then go to one side of your mouth, good, then go to the other. And then I'm gonna place my hand right here, and if you'll push on the inside of your cheek with your tongue against my fan, that's good. Yeah, perfect. Okay, everything looks good, and that concludes my assessment, and thank you for participating.
Thank you.